In the second part of this presentation, we're going to look at some of the challenges in human resources for health. As a reminder, what we will do is describe and discuss the main challenges affecting the health workforce, particularly in South Africa. To get us thinking about this, here is a question. What are the main challenges regarding the production and the retention of human resources for health in South Africa? The concepts of production and retention relate to measures of workplace performance. There are 4 of these: availability, competence, responsiveness, and productivity. With regards to availability, we're looking at space and time. Availability in terms of space and time. It encompasses the distribution and the attendance of existing workers and the adequate number that matches the need of the population. Competence encompasses a contribution of technical knowledge, skills, and attitudes and work behaviors. Responsiveness refers to people being treated decently, regardless of their social, economic, or health status, who they are, or whether or not their health improves. Responsiveness relate both to the health workforce as well as to patients. The purpose of the health service is to be responsive to the needs of the population. At the same time, we have to be responsive to the needs of the health workforce. Productivity looks at ideas such as effectiveness and efficiency, producing the maximum effective health services and health outcomes possible given the existing number of staff, and reducing waste of staff's time and their skills and other complementary resources. We're going to look at each of these in turn. When we look at the issue of availability, we can see that there are a number of challenges. And the 2 main issues that affect availability are production and retention. This is what we started off our question with at the beginning of this session. South Africa is not producing enough healthcare workers, and the ones that we are producing, we aren't able to keep. In relation to production, we see that education has not grown to meet the needs of the population or the requirements of the population. So as our population has increased, we have not been producing more healthcare workers. Output has not significantly increased over the last 15 years. We only produce about 1,200 doctors per year. We also see that 30% of specialist registrar posts are unfilled and unfunded. This means that people who want to specialize are not able to do so. In terms of retention, there are not enough posts in the public sector, and this is often due to financial reasons. We don't have the budget to fill those posts. 70% of health science graduates are not retained in the public sector. So after they have finished their studies and their internship years and their community service, they aren't likely to stay in the public sector. They will either move into a different workplace environment or into the private sector. A significant proportion of graduates, in fact, don't ever complete their community service. In some instances, they move to other countries to work as healthcare professionals there after they have been trained in South Africa. 23% of community service doctors indicated that they are likely to leave the country, and this could be because of their experience as community service doctors. 33% of all doctors trained in South Africa are reported to be working outside of the country. So even though we are training a lot of people or attempting to train enough healthcare workers to meet the needs of our population, many people do not stay in our country. The second challenge relates to competence. Competence can be measured by workplace performance, which involves skills and training. It's important to remember that health science institutions, universities, and training colleges are also part of the healthcare system. Competence is determined by what is actually taught and how skills are assessed, and how health training needs are maintained throughout careers of the healthcare workers. So as new issues emerge, healthcare workers need to be kept up to date with new developments in health. In many instances, we see that medical training has failed to meet the needs of patients and populations because there's a gap between what is required and what is actually delivered. We see that Professional bodies here play a very important role, such as the HPCSA. They have to register all health care workers, they have to regulate the work that is being done, and they have to maintain training standards. As new knowledge develops and as new challenges emerge, the health workforce needs to be kept up to date with current trends. We can think about this in relation to COVID-19. There had to be a lot of training that happened with the existing health workforce. The likelihood is that people who were trained and who are currently working in the health workforce were not trained how to manage COVID-19 because it didn't exist. So as new conditions emerge, or as new technologies emerge to address existing conditions, we have to continuously train the health workforce. The third challenge relates to responsiveness. You will remember that responsiveness can affect both patients and people working within the health workforce. The health system has to be responsive to the needs of patients, but at the same time, we have to be responsive to the needs of people working in the health sector. It relates to the conditions of work themselves, and these conditions can have a big bearing on health workers' motivation. We also see that a highly motivated health workforce is likely to have a strong service orientation, a good ethical commitment to the community or population that they're servicing, as well as strong social accountability. Supervision and support are very important factors in improving health systems responsiveness. However, we also see that there are a number of challenges in terms of what pushes people out of the health sector. One of these challenges are poor working conditions. Where there are staff shortages, we see a huge strain on existing staff. Some facilities are unhygienic and therefore unsafe to work in. There's also a lack of discipline, and this could be a consequence of poor management or supervision. We also see that where there is a lack of medicines or equipment at hospitals, people are not able to do the job that they have set out to do. In some cases, we see that healthcare workers complain about inadequate remuneration. They're not getting paid enough for the work that they are doing. There's also a lack of funded public sector posts. So in the public sector, where the need is greater, we don't have enough positions. There's also a lack of consultant posts. So after qualifying as a specialist, almost no consultant posts are made available. This forces new specialists to move into the private sector, or in fact to even move to other countries. We also see that many students have very poor experiences within the public sector, especially when it comes to their community service years. This means that they are not likely to stay in the public sector after they have finished studying. There's often inadequate safety and security at hospitals, which means that healthcare workers feel that they are at risk. And we also see that there's an inadequate supervision specifically for young doctors. We see this more pronounced in rural areas, and therefore people are less likely to want to work in those areas. The fourth challenge relates to productivity. Productivity can be measured in terms of efficiency and effectiveness. Some of the challenges that affect health workers are health systems inefficiencies themselves. These could be due to a lack of equipment or poor infrastructure, or difficult work environments. For example, if there are constant power cuts or lack of access to clean water. We also see that many health environments are in fact unsafe, and doctors and nurses don't feel protected in their workplace. There's often a high demand, particularly in the public sector, where there are huge numbers of patients and few healthcare workers to meet the needs of those patients. In the health sector itself, where there is a lack of incentives, this can affect the motivation of the workforce. Poor motivation can also be affected by lack of supervision, poor management, or lack of training opportunities. So many of these issues, in fact, lead to high attrition. Attrition means people leaving the health service, either through migration or moving to a different sector. We can see that there's a relationship between the push and pull factors that are likely to mean that healthcare workers will migrate. For example, If healthcare workers feel that their pay is too low, they will look for opportunities where pay will be higher, or where they might be able to send remittances back to their own home country. So in cases where doctors or nurses might migrate, they will migrate because they feel they will be paid better. They might be looking for places where the working conditions are better. They might also look for better resourced health systems so that they can do their work better. There might be increased career opportunities or increased opportunities to study further. So education often does play a role in motivating people to stay within the health workforce. We can also see that the impact of certain diseases have had a strong bearing on the effectiveness of the health workforce. For example, a push factor could be factors associated with HIV and AIDS or political instability. So there are many issues that are correlated in terms of what keeps a person working in the health workforce, retention, and how well they are able to work, so how productive they can be. But despite all of these challenges, we see that there are many solutions that have been put in place to address these. The first thing to do is to identify and describe the challenges. Once we have done that, we will be able to look for workable solutions.